Hello everyone, welcome back to our NABH training series. In today's session, we will cover PRE.2, which is an extension of PRE.1 and goes deeper into patient dignity, beliefs, confidentiality, consent, and participation in decision making. This is one of the most practical and sensitive standards, because it directly reflects how your hospital respects human values. In this session, I will explain each objective element in detail, what assessors actually check, practical hospital implementation, common non-conformities and how to close them. Let's begin. Standard overview. PRE.2 states, patient and family rights support individual beliefs, values and involve them in decision-making processes. Simplified understanding. Respect patients' beliefs and culture, maintain dignity and privacy, ensure informed consent, allow patient participation in decisions, provide transparency in care. This standard is about respect, ethics, communication, consent. Objective elements. First element, very important. Respect patient values, beliefs, cultural needs, and spiritual preferences. What does this include? How patient wants to be addressed, dietary preferences, veg, non-veg or religious practices, prayer time, rituals, end-of-life or post-death practices. Implementation. Capture this during admission, document in patient file, inform nursing and dietary team. Example, a patient requests vegetarian diet, must be respected. Family requests religious ritual before procedure, allowed if safe. Respecting beliefs builds trust and satisfaction. Next, respect for dignity and privacy during examination, procedures, and treatment. What NABH expects? Privacy during examination, minimal exposure, respectful communication. For photos or videos, explicit informed consent required. Identity must not be revealed. Implementation, curtains or partitions in wards, proper draping during procedures, no unnecessary exposure. Example, dressing done behind curtains, patient covered except procedure site. This is one of the most observed areas during assessment. Next objective element, very critical. Protection from neglect or abuse. What is included? Physical abuse, verbal abuse, negligence, unsafe handling, special focus on vulnerable patients, elderly, neonates, disabled, ICU patients. Implementation, bed rails for fall prevention, gentle handling, no unnecessary procedures. Example, patient falls due to no side rails, negligence, rough handling during shifting, abuse. Zero tolerance policy must be followed. Now a core requirement, confidentiality. All patient information must be kept confidential. What does this mean? No discussion in public areas, no sharing without consent. Sensitive data, like HIV status, must be protected. Avoid writing diagnosis openly on file cover, public display of patient details. Implementation, staff training, controlled access to records, secure documentation. Example, discussing patient condition in lift or corridor, violation. Confidentiality is a legal and ethical requirement. Next objective element, very important ethical right. Patient has the right to refuse treatment. What should be done? Doctor explains all options, risks of refusal. If patient still refuses, respect decision, document properly. Example, patient refuses surgery. Doctor explains risks, patient signs refusal form. Documentation is key here. Next objective element, right to seek second opinion. Patient can consult another doctor. Implementation, facilitate second opinion. Provide reports and records. Do not resist or delay. Example, patient wants another opinion. Hospital provides reports. No objection. This builds transparency and trust. Another core element, very critical. Informed consent is mandatory before major procedures. Required for surgery, anesthesia, blood transfusion, high-risk procedures, research. Key requirements, taken by doctor, explained in understandable language, includes risks, benefits, alternatives. Example, consent taken by nurse only, not acceptable, must be taken by doctor. Next objective element, right to complaint. Patient must know how to raise complaints. Implementation, complaint boxes, helpline, contact details, display process clearly. Ensure fair handling, transparency. Example, complaint system exists but not visible. Non-compliance. Next objective element, transparency in cost. Patient must know expected treatment cost. Implementation, provide estimate, explain charges, display tariff. Example, hidden charges, patient dissatisfaction, NC. Next objective element, access to clinical records. Patient has right to get records. Implementation, defined timeline, e.g., 72 hours, proper request system. Example, delay in record, violation. Next objective element, information on treatment. Patient must know, treating doctor, care plan, progress. Example, doctor rounds without explanation, non-compliance. Last objective element, patient decides who gets information. Patient chooses whether family is informed. Implementation, ask patient preference, document. Example, patient wants only spouse informed. Must be respected. Common NABH, non-conformities. Privacy not maintained. No curtains, exposure. Solution, install curtains, staff training. Consent not proper. Taken by nurse, incomplete. Solution, doctor must take consent, standard format. Confidentiality breach, discussion in public. Solution, train staff, monitor behavior. No documentation of refusal. Verbal refusal only. Solution, refusal form mandatory. Second opinion not facilitated, delay or resistance. Solution, clear SOP, complaint system not visible. Patients unaware. Solution, display clearly. Cost not explained. Billing confusion. Solution, written estimate, delay in medical records. No defined TUT. Solution, defined timeline, track compliance. Final summary, to summarize, PRE.2 is about respect, consent, confidentiality, and transparency. Staff behavior, documentation is compliance. Patient involvement is the key. If implemented properly, trust improves, complaints reduce, NABH assessment becomes smooth. In the next video of this NABH training series, we will discuss PRE.3 patient or family education, involvement in decision making or care planning. If you found this session useful, like the video, share with your colleagues, subscribe for more NABH training sessions. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.